So you want to know, is prostate cancer screening helpful? Well, in this video, you're going to learn all about prostate cancer screening and whether or not it's helpful. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher. And this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. By the way, if this is your first time on the channel and you like to get fact-based healthcare, then go ahead and subscribe below. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. By the way, the links to the disclaimer and the material in this video are in the description below. But before we sort fact from fiction with respect to prostate cancer screening, let's review how trustworthy most medical information really is. So a major problem with healthcare is that it's financially driven and plagued with exaggerations and misinformation. Additionally, most published research is false, and only about 11% of all medical treatments are of known benefit. Shockingly, much of healthcare is totally unproven, despite the fact that many treatments are still recommended, FDA approved in medical guidelines, and claimed to be standard of care. Again, the references to all the material in this video are in the description below. So what are the tests usually recommended as appropriate for screening for prostate cancer? The two tests commonly recommended by physicians to screen for prostate cancer are the prostate exam and the prostate-specific antigen or PSA blood test. But are these tests reliable, or do abnormalities with these tests simply lead you to more unreliable and risky tests? By the way, a much more reliable screening test is the MRI of the prostate, but only in expert hands. So where exactly is the prostate located? Let's check these diagrams. You can see exactly where the prostate is located, in front of the rectum and just below the bladder. In fact, the urinary channel passes from the base of the bladder through the middle of the prostate and out. Again, it was discovered a long time ago that prostate cancers can feel hard, so it became standard practice for physicians to feel the prostate. But a lot of what practitioners are feeling is according to a judgment or estimate, and what feels firm to one practitioner may not feel firm or irregular to another practitioner. So how accurate is this prostate exam? The prostate exam is highly unreliable. Essentially, the test allows a practitioner to feel only the back wall of the prostate, so anything in the front part of the prostate or in the middle of the prostate is likely to be missed unless it's very large. Furthermore, the irregularities need to be at least 1/2 to 1 centimeter in diameter before they can be routinely detectable. Of course, the deeper they are, the bigger they need to be before they can become detectable by the practitioner. In addition to the unreliability of this examination, it's important to realize that most prostate nodules are benign and due to BPH or prostatitis or inflammation, and only some are cancerous. As well, the exam doesn't let you know what type or degree of prostate cancer may be present. As well, because most prostate cancers grow sluggishly, subjecting patients to 6 monthly prostate exams or even yearly exams is patently ludicrous. Now let's look at the PSA test. How reliable is that test? The PSA blood test or prostate-specific antigen is highly unreliable. It has a false positive rate of 78%, and it's not specific for the prostate or for prostate cancer. Its so-called limits of 0 to 4 being normal is absolutely bogus, and a high PSA doesn't mean cancer, and a low PSA doesn't mean you have no cancer. But the PSA is even more undependable. Let's look. Shockingly, many of the prostate cancers detected are due to the PSA being elevated because of the enlarged prostate and not the cancer. As well, the PSA is easily raised or lowered without a cancer being present or even progressing, and the PSA cannot distinguish between low-grade and high-grade cancer. As well, lowering the PSA doesn't affect an existing cancer. More importantly, some potentially deadly high-grade cancers may produce little or no PSA. So the prostate exam and the PSA are clearly highly unreliable, but do they even meet the criteria for being useful screening tests? In fact, when we look at this screenshot, the prostate exam and the PSA blood test are both highly insensitive, non-specific, unreliable, and unsafe as they expose patients to many potential complications from additional testing. So let's dig a little deeper. It's clear that the prostate exam and the PSA are highly unreliable and that they don't meet the criteria for being useful screening tests. But do these tests save significant numbers of lives? Let's see. So after a lot of lobbying, the FDA approved PSA testing for prostate cancer screening in 1994. It's important to underscore once more that this FDA approval for PSA testing was obtained without any irrefutable and reproducible supporting data for safety and benefits. Unsurprisingly, because the PSA test is so highly unreliable when used for prostate cancer screening, urologists' own studies determined in 2009 that PSA testing failed to save significant numbers of lives. So both the prostate exam and the PSA test for prostate cancer screening are highly unreliable. They fail to meet the criteria for being useful screening tests, and PSA testing fails to save significant numbers of lives. But what about the claims about the benefits of prostate cancer screening? So despite prostate cancer screening with the prostate exam and the PSA test being unsafe and without benefits, the prostate cancer industry continues to market many claims of potential benefits. In fact, all are bogus. There is no irrefutable and reproducible scientific evidence supporting the benefits of prostate cancer screening with the prostate exam and the PSA test. Remember, healthcare is financially driven and plagued with scare tactics, exaggerations, and misinformation. I have other videos concerning prostate cancer treatments where we sort fact from fiction. So let's recap. In this video, is prostate cancer screening helpful? You learned that both the PSA test and the prostate exam are highly unreliable. Neither meet the criteria for being useful screening tests, and PSA testing fails to save significant numbers of lives. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.